Alright, so this I will be changing a dressing, irrigating a wound and getting a culture, and then reapplying the dressing. First things first, we will check our doctor's orders and make sure that we got everything we are going to. We will make sure that the patient has received medication 30 minutes prior to us changing this dressing. If they were taking pain medication, and then we make sure there's no tears in anything and that we got everything, and then we will go into our patient's room. Knock, knock. Hello, Joanne.
Hi.
How are you doing today?
Doing good.
My name is Matt. I'll be your student nurse today. We're going to be changing your dressing on your leg. First, can I get your name and date of birth?
Yes, it's Joanne Jones, 12/3/67.
All right, that's what it says here. And then, do you have any allergies?
Allergy to penicillin.
All right, so your wristband says and your mark. And then also, what's your pain level today on a scale of 0 to 10, 0 being no pain and 10 being your worst pain?
I have no pain right now.
All right, that's awesome. All right, I'm just going to get you all set up. I'm going to uncover you real quick.
Okay.
Get a little cold. And then I would put on gloves, do proper hand hygiene. Right, and then, if it's all right, I'm just going to set everything up right here. I'm going to put this right here.
Okay.
Make sure everything's easily breathable. Put in there. Make sure not to touch it. Right, there's an extra pad. Make sure to grab from the label. Make sure to lip it, you pick it up. All right, and then now that we got everything all set up, we can change our gloves and then do proper hand hygiene and check this. If the ABD has anything on the outside, we would measure that, like leakage on the way through. So we will take this off carefully, making sure not to hurt them at all. All right, and then if it did leak through, we can measure on this side as well. We'll get rid of that, as well as getting these. And this, we would assess the wound and then measure it. All right, so one way we can measure the depth of it is by sticking this in there and then putting our thumb there and then measuring it to our device here. So it is about 1/2 inch deep, and then 4 inches wide by 7 inches long. And we get rid of this and that. Next we would get ready to irrigate it. Get a syringe. Oh, after that also we would change our gloves and do proper hand hygiene before. Get 30 milliliters of whatever solution that is prescribed, but this is sterile water. And then we would get emesis basin, make sure, and then do a zigzag motion using gravity to help us make sure that it falls down. Cleaning from least contaminated to most contaminated, making it like that. Then after that, after cleaning it, we would dry it, and then we would get our culture. But first I would do change my gloves and do proper hand hygiene. For the culture, take that all the way out. Oops, sorry, Joanne. All right,
That's okay.
Then we would get samples from different areas of the tissue, break off the seal, put it in there, break the seal down here, and then send it off to the lab. We would put the patient's name, the date, what test we're looking for, and then the physician as well. And then we get that sent off to the lab as soon as possible. And then next we will pack her wound. All right, now we get another one of these. After doing the sample, I would also get new gloves if I touched the wound at all. All right, and then I'm gonna bring this out a little bit because it is a damp, wet to damp. Right, and then when I'm packing this, I make sure to stay on the inside of this and not touching the outside tissue. The outside layer of skin. And then when I'm packing this, do it in like a zigzag motion upwards. It would help if it was a real wound. Alright, and then making sure that it's all packed to the surface, like depending how deep the wound is. And then do proper hand hygiene and take my gloves. Then we'll put, we'll actually use this one, we got one left. Then put a top layer on top of that. And then ABD pad, this over the top. And then we would tape it one side, this side, and then this side. 3 sides just so it could stay breathing. We would get rid of all of our stuff, changing our gloves and doing hand hygiene, making sure the patient is comfortable, assess their pain level. We would finish up, cleaning up, make sure she's comfortable. And then on this ABD pad, we would also write my initials, the date and time that I put this on so they know how long it's been on there. And then cover her up. And then make sure she's all good, assess her pain level, and then we would document what we did, what type of dressings we used, also the type of solution that was in the dressing, and document how she reacted to the procedure, and then that should be everything.